the pancreas and the spleen. These are very important organs to know about anatomically. They are frequently scanned, just like other organs. Of course, it's important to know about their structure. They can be seen on all imaging modalities. So here is big looking at these structures radiographically using different imaging modalities. So let's talk about them very fast and a few clinical correlates here and there so that we can appreciate. Okay, so of course for the pancreas we are going to look at all this, and can start right away by the introduction. Of course, we all know the pancreas. It's a gland. It's a mixed gland because it has an exocrine component and an endocrine component. Endocrine glands are glands that empty their secretions into blood. The pancreas does that. It has unique collections of cells that we call the islets of Langerhans, which specifically produce particular hormones into blood. So because of that, the pancreas can be called an endocrine gland, simply because of that. So insulin, glucagon, and others hormones that are going to be produced to go and help in regulation of blood sugar levels. Then it has an exocrine component. By definition, exocrine glands are glands that empty their secretions into ducts. Okay, and yes, it has multiple cells that are going to be doing that. They'll be producing secretion straight into ducts, and because of that, again, we can say the pancreas is an exocrine gland because of those features. So to make everything easy, you can just call it a mixed gland with all functions, the exocrine and endocrine functions. By location, of course, the pancreas is going to be lying almost horizontally on the posterior abdominal wall. We all know the posterior abdominal wall. Okay, this is the posterior abdominal wall. The anterior abdominal wall is here. This is the anterior abdominal wall. This is the posterior abdominal wall. So your pancreas is going to be close, okay, to the posterior abdominal wall. So that's where it's going to be located. And if you use the 9 abdominal regions, your pancreas is going to be within the epigastric and the left hypochondriac regions. And it's going to be lying almost oblique, okay, within those regions. So we've said the bigger part of it is retroperitoneal, meaning that it's behind the peritoneum, anchored or attached onto the posterior abdominal wall behind the lesser sac. The lesser sac, last time we said it can also be called, yes, the omental bursa, okay? So your pancreas is going to be lying within these regions, the epigastric region and the left hypochondriac, specifically behind the stomach, okay? Or you can say specifically behind the omental bursa, okay? Because the omental bursa is that whole space behind the stomach, okay? And we say it's going to be lying oblique, close or attached to the posterior abdominal wall. As we can see here, it's lying oblique, and this obviously shows you that the tail is more posterior. This is the body. You can see the tail. The tail is more posterior because of the obliquity of this pancreas. It's going to be behind the peritoneum. This is the parietal peritoneum. And last time we said that this peritoneum is going to be almost enclosing some organs of the abdomen, like the intestines, and that's why we call them intraperitoneal. But for our pancreas, the greater part is going to be behind the peritoneum, as you can see here, and that's why we can say that it's largely retroperitoneal. It being retroperitoneal and close to the back, obviously it can help you appreciate that